Not just one issue, it could be multiple issues. Imagine having something that could address all of those at one time and doesn't involve having to take lots of pain relief tablets and all that kind of thing. We're talking about Quell's wearable pain relief technology. This is a great item we've had on QVC for quite some time, and if you own it and have tried it, we want to hear from you. Call us on our testimonial line and tell us how this has worked out for you, but we've got it today at a while supplies last price. We brought in a large quantity of these, got a great price. Happy to pass the savings along to you, but when this quantity is gone, so is the price, so is the easy pay, and in this case, the free shipping and handling. Joining us to tell us more about this is Dr. Mark Legere. He is a doctor of chiropractic medicine. Good to have you here, sir.
Good to see you, too.
Now, we see eye to eye on things. You know, it's tall like I am. All right, but I'm here all week. All right, so, Dr. Mark, talk to us about this. You and I presented this before. I think for a lot of people, they deal with chronic pain issues and they try to manage them as best they can, but at the end of the day, they just are uncomfortable.
Well, if they're uncomfortable and they're missing out on things, right? So when patients come to me, they're not necessarily saying, "Doctor, I'm diagnosed with a strain of my fill in the blank." They're coming to me because they're having problems and they want help. They want help that's safe. They want help that's effective, and they want something that's simple to use. And when I found the Quell device, I found, hey, this is something that checks all of those boxes.
It's really great. Can you show us how it works?
Sure, it's really simple. So again, this is coming out of Harvard and MIT. So what we have is a very breathable and elastic strap, and then we're going to actually have the device that sits right into it. And this is an electrode, so not to be scared, electrodes should not be scary. This is just what helps make the contact from your body over into the device itself. All we're gonna do is, on the back, there's a button. We drop the button right into the back of the device. We take off the protective covering, put it on our leg, and we're good to go.
Okay, so we have Kim who's going to demonstrate for us.
Right, so just like we talked about, so it's really meant to be simple and effective. And what we're going to do is we're going to put this button, it's going to snap right into the back. We're going to take off this protective covering. I tell patients keep the covering because when we're done with it, if we're going to have to take a shower, if we're going to go into the pool, we're going to take a bath, we want to keep a hold of that. Here's the electrodes. It's going to go on your upper calf. Now, it's always going to go on your upper calf, whether you have pain in the shoulder, the hip, the neck, and then you're simply going to press a button. What we're going to see here in a minute is there's going to be some animation of exactly what's going on in the body, but it's going to feel like a little bit of a buzzing or a tingling sensation, and that's going to then travel up the leg into the central nervous system. So when the body then goes to try to help and it releases its natural pain blockers, anywhere down the line from when the body kicks in is going to get you relief. So we're talking multiple pain points because most people don't just have one point problem, they're going to have multiple. And with the Quell device, you hit them all with one press.
Now, this is FDA cleared, is that correct?
It's the only device that's FDA cleared for 24-hour use because pain never takes a break.
Exactly, never takes a holiday. I will tell you also, you recharge this item. You simply plug this one into the wall to recharge it, is that right?
You plug it into the wall and you're actually going to have a whole week. So this is one of those things that's meant to live with you. You're not going to have to keep on charging it, and the device does the thinking. So it turns off and on, it does all the work.
How many of these electrode patches will we receive?
We're going to get 2. Each one is used for 2 weeks. So it's a month's supply.
Oh, great.
And you're going to want to give it some time because this is not for what's called acute pain or the pain that's you stubbed your toe or you kind of hurt your wrist. This is that long-standing pain that's been with you for weeks, or if not months, if not years. And the Quell device takes a little bit of time because it is natural. And but we do find that when the patients do use it consistently, that we're actually getting some fantastic results from our patients.
We've got some information about that. Dr. Mark, tell us about this.
So in general, 8 out of 10 or over 8 out of 10 people who've surveyed were improved with were satisfied in their management of pain and had an improvement in their chronic pain after 60 days. So to me, 8 out of the 10 people who I have used this are going to get a relief. That could be I'm walking the dog, could be back in the kitchen, it could be I'm not making excuses anymore not to play with the grandkids.
Right. And you know what? I think so many of us end up sidelining ourselves because we've got maybe a chronic back issue or there's an arm or a shoulder issue that is just really a difficulty. This is what's incredible. I will tell you also that ordinarily on QVC, with any product you buy, we give you 30 days to try it and you can still return it. But with this item, we want you to use it a bit longer. And we want to extend that return policy to 60 days. So now you've got 2 full months to work with this. And Dr. Mark, you say the best way to deal with this and to get the best results is to wear it full time every day, right?
Yeah, it's the only device that is FDA cleared for 24-hour use. So I find that the better and more often the patients wear it, the better results they're getting, and it's meant to live with you. You know, my personal story with this is I gave this to my aunt who was suffering from a knee replacement. She actually had double knee replacement surgery. Yep.
Good grief.
And she was struggling with being able to even have pain relief to do her exercises. She put the device on. The next day, she was already noticing an improvement so much so she actually wore it into the shower. She didn't even realize it was on, so we had to give her an extra device, but it's meant to live with you.
And that brings up a good point. Not to be submerged, not even to be used in the shower where there's water present. Just take that off. But I think, to Dr. Mark's point, it becomes so much a part of your regular day that you really don't even feel it, you know, on your leg. I also like the fact that it fits so snugly to the leg, so that way, if you're wearing trousers over this, you're going to find that that's not going to encumber what you're wearing and your outfit.
Right. I tell patients when you're getting up in the morning and you're throwing your socks on, just throw the Quell device on it. And again, it's going to think for you. You know, a lot of the pain medications, the reason why people like it is it's effective, but also because they just take the pill and they go throughout their day. But every 4 hours, every 6 hours, you're having to take another pain pill.
Well, and one of the things that I get concerned about with that regular dose of pain medication, I read all the warning labels on the box.
Oh, yeah.
I start to worry about what continued use of pain medication may have in terms of side effects for me. So I don't want to run those risks either. So this is something that is really remarkable. And with 60 days to try this, literally 60 days to try it. If you don't love it, return it and get all your money back, the money you paid for it. But I will tell you that we are hearing time and time again, customers are saying this is bringing about that temporary relief. Let's take a look at that graphic again. This really helps to tell the story of the people that were participating in the study.
So 86% of the people that we surveyed, unbiased, this is blinded surveys, that we found that 86% of the people who tried it were satisfied in their management of their pain. For me, clinically, what I really want is, does this work? You know, is this just something that we found in a small group of people? The answer is no. 81% of the people who tried it reported an improvement in their pain.
That's amazing.
What does that improvement mean to you? What does that mean? That you can go do your job. It means that you can exercise. It means that you can take care of the house. It means all those things that chronic pain takes away. With the press of a button, it helps get it back. I think one of the easy things that I'd like to show too is when we go back over to Kim is that it's effective and it's simple to use. There's a lot of technology into this, and that's what makes some of the newest technology so great. It's simple to use and it's effective.
Well, let's walk over here.
So when we get over, again, it's this very breathable, very elastic band. And on the back, there's going to be 2 little buttons. And on the back of the electrode, there's 2 buttons too. You're going to simply snap it into the back of the device. We take off the protective covering, and then we're going to wrap it around our calf. One of the questions I've gotten from patients often is, well, I'm always putting it on my calf, but I have pain in my shoulder. Why am I always doing that? And the answer is there's a little group of nerves that sit on everybody's calf. It's on both calves, but what the device is going to do, it's going to create a tingling or a buzzing sensation. It should not be uncomfortable. When the device takes over and does all the thinking, it's going to send a signal right up the leg into the central nervous system. The body is going to wonder, what is this? What is this signal? What is this sensation? And it's going to say, let me help relieve that tingling. So when the body then engages its natural pain blockers, it's going to not only help the site of pain, where the device is, but it's going to also help anywhere else in the body that's a part of the central nervous system, which is basically everywhere you got.
What I heard you say that spoke to me was the body's natural pain blockers.
Right.
This is the kind of thing that your body is using without anything else, not anything you're taking and whatnot. This is the body's capacity to manage the pain.
Right, and you hear so often these days in the news about the opioid addiction and what it can do to people's lives. And for this, it's simple. I don't have to worry about it engaging with any other medication that you may be on. It's using the body's pain blocking signals themselves to help get relief.
100% drug free.
There it is.
And I think for a lot of people that means an awful lot.
Sure.
Now, I will tell you that we are getting busy on our phone lines with while supplies last pricing in place. You want to get this while that supply does indeed last. 6 easy payments on your credit card and free shipping and handling. Dan, how many gone now? Over 300 have been spoken for. And let me remind you again, you're not getting a 30-day love it or return it money back guarantee. You're getting 60. Because Dr. Mark and the folks at Quell want you to use this for a full 2 months time period.
Yeah, I want you to use this as much as you can because it takes a little bit of time. We're not going to get that really immediate relief. You're not going to wear it one day and the pain is gone. But what we want to do and what our research finds is if you use it for 60 days, 8 out of 10 of you are going to get some type of relief. The patients who used it, and they used it consistently, had an improvement in their pain. And that could be pain in the hip, back, shoulders, legs, that plantar fasciitis where you're kind of limping throughout your day. You're going to get relief, and that's the chronic pain that is so common for so many people.
And you know what? So many people in this country just live with it because they think it's their lot in life. And maybe they're taking too much over-the-counter medication that begins to concern them. Why not give this a try? You've got 60 days to try it and still return it and get a full refund of your purchase price. So take advantage of this today and give it a go. Is there an age limitation for this?
No, there's no age limitations. The only thing I recommend is if you're wearing an implantable electronic device, so like if you have a pacemaker or if you're pregnant, I would hold off on that. But again, because it's drug-free and it's 100% natural, it's not going to interact with any medication that you may be on. But again, to kind of clear up where people get a little confused is can this be helpful for me? I don't have leg pain. The answer is yes. Is because it's using the body's pain blockers. It helps with pain anywhere in your body, and that could be shoulder, neck, foot.
Now, Dr. Martin, does this work in conjunction with a phone app of any kind, or does it just work by itself?
That's a great question. So for the people who are tech savvy, the answer is yes. We actually have an app that goes with it, and in that app we have videos. So we can show how to use it, how to calibrate it, to answer a lot of your questions. And especially for people on QVC, we have a dedicated phone line for you to call in and answer any of your questions. But it's an introduction to Quell, how to calibrate it, and then how to use it for your daily life, and then tips. So
no, you don't need this to make it work. This is just to help you out with the experience.
Right. So for people who are a little bit more tech savvy, you can use it, but you can control the device by itself by simply pressing the button. So the device will turn on by itself. By pressing the button, it'll turn off. It does all the thinking for you. And then you touched on it earlier, is that for the technology in here, it's no longer a one-size-fits-all because pain is not one-size-fits-all. With the Quell device, when you get it and you get it out of the box, you call it's calibration. So you calibrate it to your pain because, David, your pain is different than my pain, then it's different from my mom's pain. It's all going to affect us differently. So we customize the device with tapping the button or using the app to customize it to our type of pain relief.
It is an extraordinary tool for you to use. And taking a look at our claims again, just reminding you that this is something that is really pretty extraordinary for the folks that participated in the study. 86% of those folks were satisfied with Quell's management of their pain, and 81% of Quell users reported an improvement in their chronic pain after those 2 months of use.
Yeah, I mean, that's staggering use. I mean, that's 8 out of 10 people are changing their lives or getting their lives back.
And this is 100% drug-free and is FDA cleared to be used 24 hours a day.
That's it.
This is extraordinary. Let's say hello to Pam in Pennsylvania. Hi, Pam.
How are you?
We're doing very well this morning. Nice to have you with us. Dr. Mark and I would love to know, have you tried Quell or are you buying it today?
No, I bought one Quell, and a few days ago I ordered a second one.
Okay.
Because my insurance was refusing to pay for pain shots, and it took care of other pains like restless leg syndrome as well as my hip and knee problems. I would highly recommend it.
Well, we're glad that you have had such a positive experience. We need to make clear that we're not making any claims about what you specifically were dealing with and the pre-existing conditions. But the studies that we have shown you up until now have indicated a lot of people have seen improvement.
Right, and these areas that you're experiencing are common for people who are looking for Quell to be able to get them some relief. Again, you've touched on multiple pain areas. You're not talking about just your feet or just your hip. You're talking about many areas that all need addressing at once. So I'm glad you're happy with it.
I'm very happy with it, and I would highly recommend it to anyone. Like I said, I've ordered a second one to have on hand.
Exactly. Because you know what? A pain is a very personal situation. And I think for anyone who deals with it in a chronic way, meaning all the time, every day to some degree, it becomes life-altering in terms of what you can do and not do. So having something that can help manage that pain makes a big difference, doesn't it?
Yes, it does. Most definitely. It makes life livable.
Oh, Pam, we're so glad this has worked out so nicely for you. Enjoy this new one. We'll get it out to you right away, okay?
Okay, thank you so much, and have a good day.
You too, dear. Bye-bye. So let me tell you that we've now taken orders for 700 of these. We still have several hundred people on the phone lines. Dr. Mark, what a great presentation. Good to have you back.
Thanks, David.
Kim, thank you. Good to see you. Stay on the line here. We're going to get you all squared away with your new Quell wearable pain relief technology, reminding you that this will come along with a 60-day love it or return it money-back guarantee of your purchase price. Now, today's special value